The Centre for Policy Impacting Global Health is a new kind of policy laboratory. It's a very innovative partnership across Duke University between the Duke Global Health Institute and the Duke Centre for International Development. Plus it involves research collaborators worldwide. Because we want our policy analyses not just to be published, but we want them to be used by and useful to policymakers themselves. We want our research to have an influence, to have an impact on practical global health policy making. In fact, when we think about our work at the Centre, we see it as having two equally important and interlinked components. The first is policy analysis, but the second is policy engagement. And really, from day one of this centre, we've worked very hard to build these links with policymakers. It's like we have a reciprocal flow of information between policymakers and the centre. And the idea behind that is that hopefully what it means is that we're studying problems that matter to policymakers themselves, and also we think it increases the likelihood that the policy proposals and solutions that we put forward will actually be acted upon. So we really are in an unprecedented era of global health transitions. There are so many transitions going on right now. Obviously from the Millennium Development Goals era to the Sustainable Development Goals era, there is a transition in the disease patterns around the world, the so-called epidemiological transition away from infections towards non-communicable diseases and injuries. And there is very clearly a financing transition in global health, away from aid and towards mobilizing domestic resources from low and middle income countries themselves. These transitions are very interlinked, and I would say that how the international community responds to these transitions is going to go a long way in determining whether we make future global health progress, or in fact whether we stall or even go backwards. And what I hope that our new centre, the Centre for Policy Impacting Global Health, can do is, in a small but important way, help to ensure that this international response is more sound, more evidence-based, and more effective, particularly when it comes to that financing transition. If we think about some of the very big challenges that we're facing, the international collective action challenges, those that go beyond the boundaries of individual nations, some of these are really incredibly compelling. Preparing for the next pandemic, research and development for conditions of poverty, developing new antibiotics so that we can tackle antimicrobial resistance. There are crucial questions ahead about how much these challenges are going to cost, how we're going to finance them, how we as a global health community can develop the right institutions to make good on this financing agenda. And it's here that I hope that the Centre for Policy Impact in Global Health can provide some new ideas, some new thinking, and some new policy solutions to really help us with this response.